Nearly 7,000 people sick, 34 states. And as of mid-July 2026, health officials still cannot tell you what food caused it. That's not a delay, that's the parasite working exactly as designed. The culprit is called Cyclospora caetanensis. It's microscopic. It spreads through contaminated food or water, and it has one biological quirk that breaks every standard tool investigators use. Michigan alone has reported 3,762 confirmed cases. That's more than half the country's total, concentrated in a single state with no confirmed source in sight. Here's the weird part. Most foodborne illness is fast. You eat something bad, your body reacts within hours, and investigators can ask, "What did you eat yesterday?" and follow the trail. Cyclospora doesn't work that way. After you ingest it, nothing happens for 1 to 2 full weeks. 7 to 14 days of feeling completely fine, eating at different restaurants, buying groceries from different stores. By the time the explosive watery diarrhea starts, the meal that infected you is a distant memory. That incubation window is the single reason this outbreak is so hard to crack. Investigators aren't asking what you ate yesterday. They're asking you to reconstruct 2 full weeks of meals from memory. Most people can't do it accurately. They might remember a salad at a restaurant, but forget the fresh herbs they bought at a market. The trail goes cold before it even starts. The CDC has confirmed 1,645 cases of cyclosporisis nationwide, with another 5,100 still under active investigation. New York has reported 517 cases, Ohio has 438, North Carolina has 307, Illinois has logged 216. When a parasite shows up simultaneously in states thousands of miles apart, it points to something deep in the food supply chain. A widely distributed ingredient, contaminated at the source, moving through multiple supply chains at once. Past cyclospora outbreaks have been linked to raw produce, fresh herbs, leafy greens, berries, things eaten raw, grown where water contamination is possible, and distributed nationally at scale. But without lab testing linking patient samples to a specific product, investigators are working with educated guesses. 141 people have already been hospitalized. No deaths reported, which matters, but hospitalization tells you this is not mild for everyone. Treatment exists. A course of antibiotics can clear the infection, but without treatment, symptoms can last for weeks and relapse. The people already in hospital are living that reality right now. The concentration in Michigan is the detail that stands out most. More than 3,700 cases in one state, while neighboring states report a few hundred each. That gap suggests something specific to Michigan's exposure. A regional distribution hub, a particular retailer, or a local food event that acted as an amplifier. Investigators will be looking hard at what Michigan had that Ohio and New York didn't. Subscribe if stories like this are what you came here for. The source will eventually be found. It always is. The question is how many more people across those 34 states get sick in the weeks it takes to find it.